prioritization and making the right decision are both critical for medical affairs, especially today, especially with all the changes in the environment and in the industry and healthcare. And yet it is difficult for medical affairs sometimes to decide which task to do first, or which task to do and other tasks to drop. So prioritizing some tasks over the other sometimes is very critical, because if it is not commercially important, it may be patient-centric. If it is not regulatory, it may be a patient need, and so on. So prioritization and mastering the skills of decision-making is critical for medical affairs and critical for anyone working in medical affairs who wants to be strategic and to grow in his or her career. So in this tutorial, we will discuss a very simple analytical approach. 6 questions. You ask them one after the other. And if the answer is positive, then the decision is clear. If the answer is negative, you go to the second question. A very simple and short analytical approach to ensure that you have reached the right decision and you are making a decision that is well informed and very strategic. So let's hear this small video and go into the depth of these questions, the 6 questions.
Welcome to this case study on prioritization, designed to train medical affairs teams on setting their priorities effectively. Now, we'll explore how a team decides to prioritize their efforts between 2 hypothetical tasks, Task A and Task B. In our scenario, Task A involves supporting a new, innovative treatment for a rare disease. This treatment recently received FDA approval and has the potential to significantly improve patient outcomes. However, it requires substantial data, education, and awareness building among healthcare providers due to its novelty and the complexity of the disease it treats. On the other hand, Task B involves supporting an established medication that has been on the market for several years but is now facing increasing competition. Recent studies have shown that it can be effective for a new indication, and the company is planning to expand its use. Although there is existing familiarity with this medication among healthcare providers, the challenges of competition and market saturation remain. Now, the medical team has to decide to do only one task, either Task A or Task B. In most of these cases, it is almost impossible to do both tasks without compromising on the quality of work. To make a well-informed decision, the team will need to answer 6 critical questions. By systematically addressing these questions, the team will be able to determine which task should take precedence and ensure that their efforts are aligned with both organizational strategy and patient needs. The 6 questions are: what is the strategy? What are the goals and metrics? What resources are available? What are the patient needs? What are the potential risks and benefits? How can we maximize the impact of our efforts? Let's try to answer these questions to reach an informed decision by the end of this exercise. Question 1. What is the strategy? Here you have to ask yourself, what is your medical strategy, and is it 100% aligned with the overall business strategy in your organization? If the strategy is clearly in favor of Task A, then this is a strong signal that can help you decide. However, if the overall strategy does not prioritize any task over the other, you need to move on to the next question. Question 2. What are the goals and metrics? Evaluate. What are your specific goals and metrics for you? Which goals of these tasks, A or B, are more aligned with your own goals and with your organization's key performance indicators and desired outcomes? If the answer suggests a stronger case for prioritizing one task over the other, that is another signal. But if the goals and metrics are equally important for both tasks, proceed to the next question. Question 3. What resources are available? Consider, what resources do you have available for each task? Do you have sufficient resources to fully support Task A without compromising other critical areas? If Task A can be supported with the available resources more effectively than Task B, this indicates a preference for Task A. If resources are equally available or constrained for both tasks, consider the next question. Question 4. What are the patient needs? Assess. What are the specific patient needs for each task? Does Task A address a more urgent or underserved patient need compared to Task B? If Task A's patient needs are more critical and align with your mission to improve patient outcomes, prioritize Task A. If both tasks address patient needs equally, move on to the next question. Question 5. What are the potential risks and benefits? Weigh. What are the potential risks and benefits associated with each task? Is Task A's potential benefit significantly higher compared to its risks, making it a more favorable option? If the potential benefits of Task A outweigh the risks more than those of Task B, this suggests prioritizing Task A. If the risks and benefits are balanced for both tasks, proceed to the final question. 6. How can we maximize the impact of our efforts? Determine, how can you maximize the impact of your efforts for each task? Will focusing on Task A allow you to achieve a greater positive impact on patient outcomes and organizational goals? If Task A provides a clearer path to maximizing impact, it should be prioritized. If the potential impact is similar for both tasks, then additional factors may need to be considered. By answering these 6 questions, you have adopted a systematic analytical approach, ensuring you gather enough information to make an informed decision. Now, you need to look at the answers collectively and decide which task you will perform. This analytical method helps you consider all relevant factors, from strategic alignment to resource availability and patient needs, providing a comprehensive foundation for your decision-making. However, remember that this approach requires practice. The more you use it, the more adept you will become at making well-informed, strategic decisions. Good luck, and may your efforts lead to meaningful and impactful outcomes for your organization and the patients you serve.
It's a very simple question-based analytical approach that can help us first not to miss any step. It helps us to ensure that we are making the right decision. Despite the shortage in resources, despite the changing environment, regardless the environment, regardless the resources, we can make the right decision every time if we follow these 6 questions approach. Thank you very much for your attention and see you in the next episode.